Wellness Wednesday is sponsored by PD Labs.
Welcome back to We Are Austin. Thanks for being with us this morning. Our world is rapidly changing day to day, and the healthcare industry is at the forefront of much of this change. Here to discuss how pharmacies will stay cutting edge to help people stay healthy are pharmacists and clinical nutritionists, Dr. Jim LaValle and Ray Solano, who is also the owner of PD Labs, a specialty pharmacy. It's nice to be with both of you.
Nice to be with you.
Be here.
So how exactly are pharmacies and pharmacists helping change the field of medicine right now?
Well, during this pandemic, we're seeing pharmacists and pharmacies really making a huge difference and contribution to healthcare. And what we're seeing is this transformation occurring of looking at natural compounds that are safe and effective, that are really changing the course of medicine and really helping patients much differently. And Jim LaValle has really been a foundation of starting this movement years ago. And that's why I invited Jim to talk more about how the time is right for what he's been doing for almost his whole life. Right, Jim?
Yeah, 40 years now. So yeah, it's been a while. And I think the biggest thing, being a pharmacist, I've always understood the value of what a pharmacist can provide. And I think it's a ripe opportunity now for pharmacists to step up and become a lot more involved in the day-to-day health of their patients. I mean, there's so many things that they can do to empower their patients to be well. It's more than just taking medication. It's really reinforcing principles of how someone can, feel good every day. It's why we developed the Metabolic Code platform, actually, was to give tools for the pharmacist to be able to utilize those tools, pinpoint what areas of metabolism need to be worked on by an individual, and then help them by having the right information to give them, the right nutrients to select so that they can get results. Because in the end, what people really want to do is they want to feel different. They want to feel healthier. They want to be more resilient. Mm-hmm. And I think it's key that we fill that role. We're a valuable resource. And I just think it's time for us to really step up and really become inclusive of that healthcare delivery.
Mm-hmm. And I like the word you use, empower people to take charge of their own sense of well-being, and you guys can help facilitate that. You talked about the Metabolic Code. What exactly is that? Can you speak to that more?
Sure. I mean, I saw thousands and thousands of patients over the last 38 years, and I kept seeing common themes of problems that people had. They almost clustered into buckets, and I kept finding myself just figuring out, okay, what do I got to do with this person? Well, guess what? It's like the other 100 people that I saw, that they had very similar issues that needed corrected. So the Metabolic Code takes a questionnaire and your biometrics, so blood pressure, heart rate, those kind of things. And then you can do just the questionnaire and it will tell you, well, where is the person most challenged at? Are they having allergies? Are they having GI problems? Are they tired all day long? Are they less resilient to stress? Are they having trouble sleeping? Where do I need to start to change that person's life? And then if you want to add lab results to that, you can incorporate lab values to that report. And then it'll further pinpoint, yeah, this is exactly where you need to start. And so the Metabolic Code has been a passion of mine because it's one of the biggest things when I'm teaching people how to do this work is the first thing they ask is, well, where do I start with someone? Where do I start? And this helps them. I start here. And if I start here, I know this person's going to feel better because they'll feel less stressed. Their bowel movements will be better. They'll sleep better. They'll have more energy. We start doing things like that. People start getting pretty happy about, the way they feel and the way they're moving through their life.
Yes. And like you said, sometimes knowing where to begin, it just is such a sense of overwhelm. So if you can have a place to start that is powerful and going to be impactful, it can shift everything. Thank you for sharing that. Ray, you always bring us solutions and products that are truly unique. How can we get more information about all of this?
Well, for any information that Jim spoke about, we're really a specialty pharmacy that really focuses on unique solutions for patients to really give them true health care. And especially in times now for virus solutions, there's lots of choices. So we want to be a one-stop shop. Give us a call. It's 512-219-0724, or our website is pdlabsrx.com. Taylor, I do a podcast, Healthy Choices XM. It's on every week. A lot of free information. It's all on our website, pdlabsrx.com, for more information on what Jim is doing. And what we're doing is to really help out patients here in the Austin area and all across the country.
Great. Gentlemen, thank you so much for your time today and for all the work that you're doing to empower people to take control of their own health. I appreciate it. Take care.
Thank you, Taylor.
Thank you.